You've probably seen the ads: laser eye surgery from just £595 an eye. But walk into a clinic expecting a quick, cheap fix, and you might walk out staring at an estimate for over £4,000. Around 120,000 people in the UK get vision correction surgery every year, but thousands more put it off entirely because these massive price jumps make the whole industry feel like a bait and switch. That final quote comes down to biology. Cost splits into two distinct paths based on age. Under 40, you're looking at surface-level laser corrections, where lower prices live. Over 40, your eye changes, requiring complex procedures that push you into a higher bracket. Falling for the £595 marketing hook without understanding your specific age bracket needs inevitably leads to consultation shock and delayed treatment. A lot of people assume that as their vision gets worse, the NHS will eventually step in and fix it for free. That's a mistake. The NHS classifies laser eye surgery and the desire to ditch your glasses strictly as a cosmetic procedure. Routine funding for this simply does not exist. The only time the NHS covers surgical intervention is if a specific eye disease, like severe cataracts, directly threatens your ability to see at all. This matrix shows the outcomes. The NHS provides a monofocal lens, so you'll still need reading glasses. A private multifocal lens gives visual freedom, but costs up to £4,500 per eye. Plus, relying on the NHS means waiting 8 to 18 weeks. The bottom line is simple. If your goal is to wake up and see clearly without reaching for your glasses, you have to navigate the private market and pay out of pocket. Let's look at that under 40 demographic, where the primary goal is correcting standard distance vision. Your baseline option here is LASIK. It's the most common procedure, and a realistic price in the UK right now ranges from roughly £1,700 to £3,000 per eye. While you can see clearly almost immediately, standard LASIK takes between 3 and 6 months for your vision to fully stabilize. If you play heavy contact sports or have thin corneas, LASIK won't work for you. You'll need LASIK instead, which comes in slightly cheaper at around £1,500 to £2,400. But those savings come with a catch. LASIK requires a significantly more painful recovery period, lasting 1 to 2 weeks. Then there is SMILE, the premium option for younger patients. As this chart plots out, it sits at the top of the price scale, between $2,500 and $3,250 per eye, but the healing time drops to just a single week. For the under 40 crowd, paying above the baseline LASIK price simply buys you a faster, less invasive recovery. For most, standard LASIK remains the best value. But everything changes once you cross that 40 to 50 age threshold. Your eye biology physically shifts. You develop presbyopia. The natural lens inside your eye stiffens, slowly destroying your ability to focus on close-up objects. It happens to everyone, despite what the marketing implies. Standard LASIK does absolutely nothing to fix presbyopia. This creates a major financial trap. An older patient might buy cheap LASIK to fix their distance vision, only to realize they are still completely dependent on reading glasses the moment they look at their phone.
Because over 50s face structural changes deep inside the eye, surface-level lasers won't cut it. Those £500 ads are completely irrelevant to this demographic. The actual medical solution for aging eyes is lens replacement, or RLE. It carries the highest price tag, running between £3,000 and £4,500 per eye. Instead of reshaping the surface, the surgeon physically removes your failing natural lens and replaces it with a multifocal artificial implant. This split screen shows what you pay for. LASIK reshapes the surface cornea, while RLE goes deeper, replacing the internal lens. It instantly cures presbyopia and permanently prevents cataracts. However, this deeper internal surgery requires a 4-week recovery period to fully stabilize. There is a budget compromise for the over 50s called monovision LASIK, which costs between £2,000 and £3,500 per eye. With monovision, the surgeon tunes one eye strictly for distance and tunes the other eye specifically for reading. It saves you thousands of pounds, but it compromises your depth perception. More importantly, it leaves your natural lens in place, meaning you are still entirely vulnerable to future cataracts. For the over 50s, the £4,500 premium for lens replacement buys a permanent biological upgrade, securing clear vision now and future-proofing the eye against cataracts for life. Beyond your age and procedure, a few specific logistical factors will move the needle from that base price to your final clinic quote. Having a highly complex prescription or opting for premium mapping technology like wavefront-guided lasers automatically drives up the cost. Your location matters too. Booking at top-tier London clinics like Moorfields or Focus Clinic guarantees a 10 to 30% surcharge compared to regional chains. If those high numbers cause you financial anxiety, know that 0% financing is universally offered by major UK clinics. Providers like Optical Express and Optegra routinely offer 12 to 24 months of interest-free credit. The catch is the upfront cash. Securing manageable monthly payments of around £100 to £150 usually requires a strict 10 to 20% deposit. While the sticker price of advanced surgery can be intimidating, the widespread availability of interest-free credit makes premium procedures cash flow accessible for most private patients. Let's pull this pricing and biological data together into a clear decision matrix, mapping upfront cost against long-term vision utility. Rule 1. Under 40 with a mild prescription, stay in the budget-friendly LASIK zone and budget between £1,500 and £2,500. Rule 2. If you play contact sports or lead a highly active lifestyle, upgrade to the mid-tier SMILE or LASIK zone. Rule 3. Over 50, ignore surface laser ads entirely and prepare to invest up to £4,500 per eye for lens replacement. Before you hand over any deposit, you need to clear a few non-negotiable safety checks. Regardless of how cheap the procedure sounds, always verify the surgeon's GMC registration and check the clinic's CQC rating. Shopping for eye surgery on price alone is a trap. The ultimate return on investment comes from matching the procedure exactly to your age and eye biology.